You need to hear this. 8 everyday things most people do without thinking can quietly hurt your kidneys over months and years. I'll go through each one, explain how it stresses the kidneys, give practical thresholds or red flags where we can, and tell you exactly what to do about it. Stay with me until the end. If this helps, consider subscribing and turning on notifications so you don't miss the follow-ups on blood pressure and diabetes control. And give this video a like if you find it useful. I'm a clinician who sees kidney problems every week, and I say this with the calm urgency of someone who watches preventable decline far too often. Your kidneys are 2 fist-sized filters that sit low in your back. They keep fluid and electrolytes balanced, remove waste, help control blood pressure, and produce hormones that keep your bones and blood healthy. Because they work quietly, early damage rarely hurts. You may only notice subtle signs. That's why habits matter. Small, repeated stresses add up. If you're wondering whether you should check something now, start with 2 simple screening tests. A blood test called serum creatinine, which estimates how well your kidneys filter, and a urinalysis, a simple urine test that looks for protein or blood. An ultrasound may be used later if the tests suggest a structural problem. If you have high blood pressure or diabetes, check these tests at least once a year or as your doctor recommends. Now, let's look at the 8 habits I see breaking kidneys more often than people realize. First, ignoring high blood pressure or managing it poorly. High blood pressure is the single most common driver of chronic kidney disease in adults. Imagine your kidneys as delicate plumbing. Sustained high pressure wears the tiny filtration units, makes them leaky or scarred, and over years, that loss of filtering capacity becomes permanent. Practically, if your home blood pressure readings are often 140/90 mmHg or higher, or your clinician has told you have hypertension, this is not a light risk. What to do? Measure your blood pressure at home regularly. Once a week is a reasonable start if your numbers have been stable. More often if your readings are high or you're adjusting medications. Share those readings with your clinician and follow a plan to lower pressure through diet, activity, medication when needed, and salt reduction. A brief exception: if you're young and have occasional high readings from anxiety or pain, we still confirm with repeat measurements before labeling it chronic. Second, uncontrolled or long-standing diabetes. High blood sugar damages the fine filters of the kidney over time through glycation and inflammation. I've met people who only discovered kidney damage after years of borderline sugars. If your HbA1c is consistently above individualized targets your clinician sets, or you've had diabetes for many years, your kidneys are at risk. What to do? Tighter blood sugar control under medical guidance reduces the risk of progression. Regular screening, urine for albumin, protein, and serum creatinine lets us catch early changes. Exception: short-term spikes after a single illness don't define chronic risk, but patterns do matter. Third, habitual high salt intake. Salt makes the body retain water and raises blood pressure, and high salt intake increases the workload on the kidneys. The World Health Organization recommends less than about 5 grams of salt per day, roughly 1 teaspoon, though averages in many diets are much higher. For people with existing kidney disease, lowering salt often helps control blood pressure and reduce protein in the urine. What to do? Cut back on processed and restaurant foods, read labels, flavor with herbs instead of extra salt. If you have conditions that require higher sodium for medical reasons, follow your clinician's tailored advice. Fourth, frequent or prolonged use of over-the-counter non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen or naproxen without medical supervision. These medicines reduce blood flow to the kidney by interfering with local hormones that keep filtration steady. And with repeated courses, especially 5 or more consecutive days of unsupervised use, they can precipitate acute drops in kidney function or make chronic issues worse. What to do? Use them sparingly, take the lowest effective dose for the shortest time, and ask your clinician about alternatives if you have high blood pressure, heart disease, or pre-existing kidney problems. Exception: sometimes a short doctor-advised course is appropriate. Chronic, self-directed use is the main danger. Fifth, excessive use of supplements, vitamin D and certain minerals in particular. Vitamin D is common and often assumed safe, but very high levels can raise calcium in the blood, increasing the risk of kidney stones and, with prolonged excess, impairing kidney function through calcification. Clinically, we consider levels above approximately 80 to 100 ng per ml as approaching excess, though thresholds vary. I always recommend checking blood levels before starting high-dose supplements. What to do? Don't take high-dose vitamin D or multiple mineral supplements without testing and oversight. Follow your clinician's guidance and recheck levels if you're supplementing. Exception: people with documented deficiency under supervision may need replacement. Supervision is the key. Sixth, very high protein diets over long periods when kidney function is already reduced. Protein increases the kidney's filtering load. In healthy people, this is usually well tolerated. But in those with existing reduction in kidney function, consistently very high protein intake may accelerate decline.
What to do? If you have normal kidney function and no other risk factors, moderate protein, balanced with other nutrients, is generally safe. If you have chronic kidney disease, discuss an appropriate protein target with your clinician or dietitian. Avoid extreme single-nutrient fads without professional advice. Seventh, smoking and excessive alcohol. Smoking constricts small blood vessels and increases oxidative stress and inflammation, factors that worsen kidney disease progression and interfere with blood pressure control. Alcohol in excess can raise blood pressure and contribute to metabolic problems. General guidance is up to 2 standard drinks per day for men and 1 per day for women, and less or none if you have comorbidities. What to do? Quitting smoking is one of the most beneficial changes you can make for your kidneys and overall health. Aim to limit alcohol and discuss safe levels with your clinician if you have kidney risks. Exception: occasional social drinking within recommended limits is lower risk, but combined with other habits, it can add up. Eighth, ignoring recurrent kidney stones, recurrent urinary tract infections, or structural problems. Recurrent stones cause repeated irritation and sometimes obstruction. Repeated infections or anatomic blockages can scar kidneys over time. If you've had multiple stone episodes, persistent urinary symptoms, or imaging that showed obstruction, these are red flags. What to do? Seek evaluation, stone analysis, metabolic testing when indicated, imaging studies, and urology or nephrology referral. Treat infections promptly and work with your clinician to address underlying causes. Interwoven with these 8 are a few myths I encounter constantly. People ask if coffee destroys kidneys. Moderate coffee intake is generally safe and does not cause kidney disease in healthy individuals. Sparkling water, carbonation, does not harm the kidneys by itself. What matters is added sodium in some sodas or mineral waters. Garlic and citrus fruits are not kidney destroyers. In fact, fruits and vegetables are part of healthy eating patterns. The danger lies in extremes and in unmonitored supplements or diets, not in ordinary culinary use. Let me give you a human moment. A patient I'll call Maria came to clinic because her ankles had swelled slightly and she felt tired. She was terrified. Her sister had dialysis. The exam and tests showed mild protein in her urine and a serum creatinine a touch above her baseline. She was taking over-the-counter pain pills for an old backache, eating lots of salted snacks, and had high sugars at times. We sat at the small desk where the BP cuff hissed as I rechecked her pressure. The antiseptic scent and the soft click of the chart file were ordinary, but the conversation was not. I told her we could change the path. Stop unsupervised NSAIDs, cut salt, check vitamin D and blood tests, and set up closer glucose and blood pressure follow-up. A year later, her numbers were steadier, and she had avoided progression. She told me the relief of action was as healing as the tests. Stories like hers are why prevention matters. There are some practical thresholds and tests I want you to remember. If you have risk factors, hypertension, diabetes, family history, get a serum creatinine and urinalysis at least yearly. If you take supplements, ask for a 25-hydroxy vitamin D level before high-dose use. If you use NSAIDs regularly, try to limit courses to short, infrequent periods and speak with your clinician about safer options. If you notice persistent swelling, unexplained fatigue, persistent changes in urination, foamy urine, blood in urine, or needing to go much more or less, or recurrent stones or infections, seek evaluation sooner. Now for the heavier emphasis.
Among the 8 habits, poorly controlled blood pressure and diabetes are the biggest, most commonly preventable causes of kidney failure. They act together. High glucose damages small vessels, and high pressure accelerates scarring. Controlling both cuts risk substantially. If you have either condition, a home blood pressure monitor and regular check-ins with your clinician make a difference. For many patients, a weekly log, more frequent at first, helps us titrate treatment and spot patterns. What can you start tomorrow? First, measure your blood pressure at home and record it. Bring the record to your clinician. Second, look at your salt. Reduce processed foods and aim toward about a teaspoon, approximately 5 grams, daily as a benchmark. Third, check with your clinician before taking any new supplement or starting prolonged NSAID use. Fourth, if you smoke, ask for support to quit. Various programs, medications, and counseling help. Fifth, get the simple screening tests, serum creatinine and urinalysis. Knowledge is power. I want to be clear. This information doesn't replace individualized medical advice. If you have symptoms or chronic conditions, consult your healthcare provider. Medicine is personal. What's safe for one person may need adjustment for another. If this discussion helped clarify things for you, please subscribe and turn on notifications so you can follow the other videos I mentioned about blood pressure and diabetes management. Leave a comment telling me where you're watching from and which habits surprised you the most. Your question might guide a future video. If you or someone you know is managing kidney disease, share this so we can get accurate information into more hands. Take the small step today. Book that screening, check your supplements, and pause before reaching for over-the-counter painkillers without advice. Your kidneys work quietly every day. Give them a little protection and they'll keep doing their vital job. Before we close, one last practical checklist you can carry with you to the clinic or keep on your phone. Bring a 1-week blood pressure log and any home glucose readings.
List all medications, supplements, and regular over-the-counter drugs you take. Note symptoms: swelling, changes in urine, persistent fatigue, recurrent stones or infections. Ask your clinician for serum creatinine, urinalysis, dipstick or lab, and, if relevant, a 25-hydroxy vitamin D level. If you smoke, request a referral or medication to help quit. Small programs double your chances of success. If you have diabetes or high blood pressure, set a concrete follow-up plan, frequency of checks, targets, and who adjusts medications. Small, consistent steps count. Maria's case was not dramatic in the hospital sense, but the combination of clearer information, a safer plan for pain control, less salt, and closer monitoring changed her trajectory. That's the point. Many kidney problems are silent for a long time, and yet are preventable or slowable with attention. Resources. Reliable patient information is available from national kidney foundations and from your primary care or nephrology clinic. If you're unsure where to start, ask your clinician for a basic screening order and for guidance on safe supplements and pain relievers. If you have emergency symptoms, sudden breathlessness, severe swelling, very low urine output, or confusion, seek urgent care. Thank you for trusting this information. If this video helped you, consider sharing it with someone who might benefit. Leave a comment with the habit you'll change first, and if you want a deep dive on blood pressure or diabetes management for kidney health, tell me which one you want next. Take that step today. Book the test, bring the list, and protect the quiet work your kidneys do every day.